For it. Now let's come to our second presentation of this third World Congress, chronic disease to treat them successfully. Now we have heard about the basics now, and now it's a great pleasure for us to be able to welcome Mrs. Karin Schußmann. She is the owner and manager of the largest clinic in Germany working with bioresonance according to Paul Schmidt's with 40 devices. So she is very well known. She is a star. She is also responsible for the development in treating neck, shoulder, spine diseases. She's an expert in infectious causes, and we talked about the noxes. So this is where we meet. Mrs. Bunkenborg, what does occur to you when you think about Mrs. Karin Schußmann? When I hear the name Karin Schußmann, I think immediately about the 70 programs. All of us, I hope you know that what the 70 programs are. They are used so often because they're just wonderful. There is so much experience in it. There is so much science in bioresonance, all in one, without having to use tests. And I think this is something which many users have been taken advantage of. Well, the desk has been disinfected and the presenter is available, and therefore I would like to ask you, Mrs. Karin Schußmann, to take...
Guten Morgen, meine Damen und Herren.
Good morning, ladies and gentlemen. I'd like to welcome you and hope you're having a good time. My name is Karin Schußmann. I'm a practitioner and I'm the manager of the Bioenergetic Center in Melbourne. I'm extremely glad that so many people registered for the Third World Congress, and this is really fantastic feedback. The topic of today's presentation is the study of chronic pain for neck, shoulder, and spine pain. It's a randomized prospective, double-blinded study which we carried out in our clinic. We had 4 polar devices which were exclusively available for this study. 2 out of which were placebo devices without any function, which we couldn't see and which you couldn't hear. So no one knew which were the placebo devices and which were the real ones. But so we didn't know which polars worked and which one didn't work. So, and the whole clinic, and such as nor us, nor my husband, no one knew which of the devices were real devices and which one were placebo devices. Now, the patients that we tested with had been designed or assigned by a computer on the basis of coincidence and random. So no one among us had the possibility to interfere and make a decision. The objective was to prove that bioresonance, bioenergetic treatment with Polar 4.0 can be effective and doesn't have any side effects. It was a fantastic pleasure to be able to carry out this study because there hadn't been any studies, any similar studies which had been carried out in the meantime. And no study has been so scientific, and it has given evidence that the Paul Schmidt therapy is effective. So we had to use the same criteria as the pharmaceutical industry before licensing any new medication. And I have 20-year experience, and I know that the therapy works, but we had to find scientific evidence. Now, our team in the clinics consists of 2 practitioners, employee practitioners, and myself. We have 4 experts working at our clinic. and we have just celebrated our 20 years anniversary. Our working methods is cause-oriented. The question why someone gets sick isn't asked very often in the classical medical area. Of course, if someone has a problem with his heartbeat, then people just realize that classical medicine just realizes that the heartbeat is not right, but no one wonders why is this the case? How come that this patient developed this disease? Now, patients are then just being treated for the symptoms, but the causes are not being looked at. But this is not enough for us. We want to look at the causes. We want to make sure that the patient can be treated and get well sustainably as much as the body and the condition of the patient permits. Some patients, of course, have irreversible damage, so we have to live with it. But as far as possible, we want to make patients healthy again. Now, the working conditions and working methods are the following. Every patient will be analyzed. So all the functions of different organs will be tested, and the possible damages will be found out if there is. If it's any bacteria, viruses, heavy metals, electrosmog, geopathic disturbances, all these issues lead to diseases. What's very important for a healthy life is also recognizing any of the genetic possible causes which can cause diseases. And these are things, these are diseases which can only be felt and seen decades. Sometimes we have some severe diseases such as cancer diseases. We can investigate patients very well on these different levels. Also, shortcomings when it comes to food. So we can realize that some minerals are missing or some vitamins, and we're going to substitute them with our own supplements we have available in order to make sure that all these food and nourishment of the patients will be improved. And we try to get the patient at a good level in order to make sure that his or her immune system works well, and that he or she will be continuing after the treatment at home with that new diet. I have developed a specific test, treatment tests, in order to find out about the patients. I've developed this test. It's very precise, and it's comparable to a blood analysis. We should always try to recognize the present causes and have a look at structural changes which may have taken place. My dream is that when you get born, that you already you can be recognized, or we can recognize any of the shortcomings or diseases. We've been doing this for 20 years, and we can imagine that these new recognitions of causes and diseases can be added up and can certainly be expanded, so we can make huge progress. And there is the question, what kind of environment does the patient live, or has he or she lived? Because infectants can only survive in a certain environment. It's very exciting and thrilling to find out more about it and to be able to treat these diseases. There's no disease without any cause. And the same applies to the syndrome, neck, shoulder, and spine. It's very common. So therefore, it was not difficult to get 52 people who were ready to get examined. The therapy program had to cover all causes, because we didn't choose the test persons according to their diseases. So it was kind of a blind attempt. But since I had a 20-year experience, I know which causes which ones we have. Of course, there can be diverse, it can be different viruses, bar virus, it can be chlamydia, which are contaminated by insect bites. It can be streptococcus, all virus, all kinds of different bacteria, a pneumocystis or any fungus. So it can be anything and everything. So this means that whatever could be the cause should be covered. And all these different viruses and bacteria can also affect the nerve, which comes directly from the brain down to the spine. Then nervus accessorius can also, the shoulder muscles and the spine can also be infected by these infectants, bacteria and viruses. This is exactly where the pain starts. But just to treat it on its own would be easy. But what we want to do is we want to get at the cause of the central nervous system, the peripheral nervous system, the muscles, nerves, elsewhere in the body, also the kidneys, the bladder, and of course in the blood. These infectants can be in the blood anywhere. And they can also, we also have to have a look at the DNA. So any of the organic systems can be affected. And any of these can be treated with a therapeutical program. So we have to have a program which covers all these different causes. In order to do something about it sustainably, all these infectants have to be removed out of the system, because they could still be elsewhere. I mean, if we just treated the blood, they could still be in the bones. So this would not be sustainable. What we want to do is a sustainable treatment to remove them permanently and get rid of any of the poisons, toxins. And this explains the duration, the long duration of the therapy. 2 hours and 10 minutes every test person had to sit in our clinic for treatment. The program is then saved in the body of the patients. 70% of our body is water. And this is something we use for our therapy, because the program can be saved. It will be then there for about 2 days. It will be in the system. So that's why we need 2 therapy a week. Well, normally the study would then end for the test persons. Well, those people who were sitting at the placebo devices couldn't improve and still had their pain. But I have to mention, Professor Heines was very generous, and he allowed me to use the Ryonex, so we could use the Ryonex devices in order to get special therapy to these placebo patients afterwards, and they got it paid. So that was great, in order to avoid any disappointment. So this is the end of my presentation. I'd like to thank for your attention. Well, thank you very much. It has been a matter of course for us that those people who had been treated with a placebo device during that study should be treated later on with the real device, so they also can take advantage of the positive effects of the therapy and should not be disappointed. I think this is was just obvious for us. So we thought it was indispensable in order to avoid any after disappointment. So it worked out very well. Thank you very much for your presentation.
We, in fact, have carried out this study program with everybody, with every patient. So in this respect, we had the same procedure. I would like to know if the technical department has been able to take up some questions. So I'd like to show the first. The question is, what is the most common disease treated at your therapy center? Well, nice question. When does a patient come to us? When they have not been treated sufficiently in traditional medicine, in conventional medicine, because the pressure is high and people only come to us when they have too much pain. They have pain, but very often, well, it starts right now with borreliosis, together with other bacteria that also come with it. In summer, they are the most diseases we treat. Right, thank you very much for the answer. Do we have more questions? Yes. You deal basically with energetic, pathogenic pressure. Do you see a different pressure or disorders due to the climate change and increase of a disease like malaria, leishmaniasis, or Western Nile? Yes, it is. In malaria, there are plasmodia, and there are 3 that can make us ill. And for 6-7 years, since 6-7 years, I've found plasmodia, this malaria pathogens in patients, that has increased. First, it was some patients with Plasmodium cynomolgi, but we have all 3 sorts, also Bivax and falciparum, and they don't occur, let's say, not as acute as you may have it in Africa, because we have here the drinking water, and they are undernourished, but they appear, they create symptoms, but not as acute as you think of a malaria patient with fever. It's not that hard, but due to the climate change and the heat, we also some malaria pathogens. Leishmania, we had them always, but they had been people who had traveled a lot and had stayed at these areas, but it has always